How would somebody know that they're having a heart attack?
It's not always easy to tell, but it's important to be aware of the typical and the not so typical symptoms. People talk about the heart attack as a crushing chest pain, and indeed that can be what you feel, an aching type pain in the chest that goes into the arm or the neck or the jaw, associated with shortness of breath or some sweating. And if you develop that, it's important to pay attention to those symptoms and seek medical attention earlier. However, in particularly women and sometimes in the elderly, the symptoms are not quite so classical. And it could be something as simple as shortness of breath, just an episode of profound sweating, nausea, ill at ease, lightheadedness. And in those patients, it's probably good to go to the emergency room as well to have it evaluated.
All right, so if you think you're having a heart attack but you aren't sure, how long should you wait before you go?
Well, it's best to get to the emergency room as soon as possible. And the mechanism is in place to evaluate those people, to monitor them, to determine if they have had a heart attack or in the process of having maybe a small heart attack that isn't totally obvious when they walk through the emergency room door. It's important to remember that time is heart muscle. And the sooner you can get to an emergency care center, get to the emergency room, and be evaluated when you're having a heart attack, the more heart muscle that can be saved. And the more heart muscle that can be saved improves your long-term ability to survive a heart attack.
Getting to the hospital, is that something you can do yourself? Can you have friends drive you? Or is that a time where you need to call an ambulance?
You should call an ambulance. Because in the early stages of a heart attack, electrical problems can occur with the heart such that the heart doesn't effectively pump blood. And you need the emergent care intervention, sometimes to save your life. So it's best not to gamble that your friend's going to get you there in time or that you won't have a problem until you get there. You should activate EMS and get them involved right away.
While you're waiting for the ambulance to come, is there anything you can do?
Usually take some aspirin. The aspirin works on the platelets, and you've seen the commercials with the various aspirins suggesting that it does improve survival of heart attack, and it in fact does. So taking an aspirin, chewing an adult aspirin if you don't have baby aspirin, 4 baby aspirin if you have them, chewing an adult aspirin if you don't have baby aspirin.
Do you think there's anything else that somebody has to know about heart attacks or heart conditions and how to prevent them?
Well, prevention is a whole other huge topic. But before we leave the topic of getting to the emergency room, it is important if you have anything, any chest pain really between your jaw and probably your belly button. Any discomfort into there, aching associated with maybe some shortness of breath, particularly if it goes into your arm or up into your neck, it's probably good to get that checked out. Some people tell me, oh, I feel silly going to the emergency room. It's better to be on the side of safety. Get to emergency room, get evaluated. Now, as far as risk factors are concerned, there's a ton of risk factors for heart disease. And very quickly, don't smoke. Go to your doctor, get your blood pressure controlled, make sure your cholesterol is controlled. If you have diabetes, treat it, and exercise.
Dr. Jones, thank you for joining us, and thank you for giving us all that valuable information.
Thank you. Thank you very much for having me.